Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. Welcome everyone back to another episode. Today I'm with Dr. Julia Jackson. She is an oral and maxillofacial surgeon practicing in Virginia. Julia, thank you for joining us on the podcast today.
Thank you, Dr. Stucki. It's good to be here, and I can't wait to introduce myself to your listening audience.
Yeah, same. Excited to talk to you. Could you start by just giving us kind of a brief history of your training, your background, and kind of your current practice setup?
Sure. Let's say in 2005, I graduated from Temple University School of Dentistry. At that point, it wasn't called Kornberg yet, so I still have the original Temple Dental graduation certificate. I have a DMD degree in Philadelphia. I'm from Philadelphia. In Philadelphia, you can get a DMD from two places, Temple and Penn. So they're kind of rivalries. And because I'm from Philadelphia, I know the Philadelphia kind of history between Penn and Temple. So it was good to be on the clinical side. Penn is more research-based and Temple is a clinical-based program. So I'm really good with my hands. And I remember being in Temple Dental. I was the secretary of the Oral Surgery Honor Society. I was the vice president of my class. And so I really just enjoyed being a part of the curriculum and learning how to become a dentist. But I have to be very honest with you, Dr. Stucki, I wasn't going to ever be a general dentist. It was never an option. It was never in my point of view. I came in there knowing I was going to be an oral and maxillofacial surgeon, and I certainly did walk out, in that appropriate fashion. So I finished Temple Dental in 2005. I was also very specific that I wanted to go to Penn with Dr. Raymond Fonseca for an internship. And to make a long story short, it didn't happen. You can be as focused as you want, but if the spots are limited to two, which generally were Penn graduates, I couldn't get myself in there. But somewhere along the lines, 2005, I received a phone call from a program in New York, Brooklyn Hospital Center. And it was for an internship opportunity. At that point, I wasn't really ready for a 4-year commitment, but I was ready for some type of exposure to oral surgery, being as though that was the plan. So 2005 to 2006, it was myself and one other female intern. And we worked so hard. We did all the SCUT. We did all the miscellaneous organizations of getting the labs and getting the x-rays and getting the charts together, getting the patient history, admitting patients, whatever they dumped on us, we figured it out, even at 4 a.m, it's laceration in the ER. So I did that for the first year. And this is a message to those that have had some trials and tribulations. At the end of the first year of the internship, they offered her the opportunity to be first year. And they didn't offer it to me. I said, why? I'm working just as hard as Ann. What's going on? And they said, well, we'll give you an opportunity to do another second year. I said, okay, no problem. And Ann, terrible, she looked at them and said, I would never be a resident here. You treated us horribly. You were not friendly. You didn't nurture us. I would never put myself in this position. I said, Ann, what are you talking about? So Ann wandered off. I guess she went to Wisconsin. She never became an oral surgeon. I took the second year position, again, working myself to the quick. And loving it, Dr. Stucki. I would do it again if I could. You couldn't take it away from me. I would never like try to erase that point in my life. So now second year, I learned two things I learned, and this is for your listening audience. Number one, apply to more than one program. Do not limit yourself because only life has all these options. Don't be too picky. And two, don't say no if someone offers you an opportunity. Always take it. You know, we don't want to. I think there's a statement: don't look a good gift horse in the mouth. You know, if someone's offering you something, you say yes. Don't say no. Right. So the second year, they offered the opportunity to the second intern. Again, another, I guess someone could say slap in the face, but it just really just encouraged me to keep going. And I had done a couple of interviews, including a 6-year program at Drexel University and also a program in California. It was, at the time, it was called King Drew. And so I kind of knew that I had more concrete options at that point. And this is, 2007. So I'll have to wrap this conversation up. And so I got into Howard University, and I was stunned because I didn't even really think Howard was the option. I thought I was going out to California to King Drew. I called King Drew and they said, well, you know, our program is falling apart. So again, folks, even if things are starting to fall apart around you, keep hope alive. They said the program is falling apart and we wanted you to have an opportunity through Match to get a program that was going to accept you. And then if you wanted the opportunity to turn away from them and then come to us knowing our program was kind of in a transition, we at least wanted you to have that. I said, oh, well, thanks for the opportunity. And then the department chair said to me in a kind of mentor-mentee way, he said, but I want you to know, I think you should go to the program that's accepted you. I said, okay. And not just that, but do not rent where you're going to live. He said, you're going to be in this 4-year program. Don't give your money away to a landlord. Purchase something. So now I have a lot of information and I'm trying to figure out what is my life going. I thought I'm going to California. Now it looks like I'm going to Washington, D.C. Howard is a whole nother type of school. So I say, okay, let me figure this out. I had saved money because I lived in New York, and New York, as you all know, has a very high income per capita. And also they have a high living expense. But what you don't know is that as an intern, they covered my living expense. So all the money that I made as a resident and intern, I was able to collect. So I used that money as my down payment for the first property that I purchased in 2007, which is a condo. So this kind of story weaves into, not only am I today a real estate Mongol, if that's the right word, because I own more than one property, but I also figured out a lot of good steps of best practice starting in the beginning. So yes, I bought my first condo in 2007. I think I was less than 30 years old. To own your own property was pretty good. And then I started my 4-year program at Howard University. The condo's within walking distance of the hospital. So 2:00 in the morning, suture circumstance or laceration really didn't disturb me. I did the 4-year program, and then in 2011 I finished, and I moved back to Philadelphia to work in an oral surgeon's office who took out my wisdom teeth when I was a little kid. He was my dad's tennis partner. And so Dr. Scott was a family friend and a strong mentor. And he was really proud of me for finishing, finally oral surgery program. And so really I did take 6 years to do oral surgery because I did the 2-year intern and then 4-year program. And I got right into the hustle and bustle of private practice. Probably some of your listeners are trying to figure out whether or not they're going to start their own practice. Are they going to buy in as an associate? Are they going to join a DSO? Are they going to, how long does it take to become an associate? What does it mean What is sweat equity? Dr. Stuckey, do you ever talk about sweat equity?
Oh, yeah.
Yeah, right? Try to make
Yep.
sure so that you can work enough so that the practice sees your potential and says, okay, you can become an associate based on your production. And I just knew I was going to stay there for the rest of my life. And then this wonderful, handsome Prince Charming that I had met in 2009 in residency. Now it's 2011. I'm in Dr. Scott's 2012, 2013. He says he wants to marry me. And us lady oral surgeons, that's a big deal, because we never know that there's a light at the end of the tunnel. We never know that we can actually be wives or better, we could actually start a family. So when he says he wants to marry me, I said, what time? And he had a stipulation. It was that he absolutely refused to live in Philadelphia. Now, that was heartbreaking because that's my hometown. And I was already really good in with Dr. Scott and things were together. I said, what do you mean you can't live in Philadelphia? He said, well, his job would not facilitate him being productive in Philadelphia. And I kind of understood that, being in his computer science and IT world. Philadelphia wasn't really a place for him to grow. And so you have to follow your heart, ladies. And I did. I took a leap of faith. We got married in 2013. Dr. Scott paid for all the alcohol at the wedding. So nice. He was wishing me goodbye. And so I started in 2014 in the DMV. So in Philadelphia, DMV stands for Department of Motor Vehicles, because that's what we know it. Yeah. But here in the DMV, which is DC, Virginia, and Maryland, that three states, the tri-state, I know, right? I had to change my mind thinking. So here in the DMV, since 2014, so that's 10 years strong, I've been practicing oral and maxillofacial surgery. So that's my short story for how I've been practicing for more than, at this point, 15 years. And then I started the school, and I guess we'll get more into the school. So that's my story. I'm sticking with it.
That's incredible. And you were mentioning to me that it's accurate to say are you the only African-American female oral surgeon?
I'll say this. I'm the first. I'm the first African-American practicing female surgeon in Pennsylvania. I was the only one. I mean, I would go to the Pennsylvania oral surgery meetings, and I walk in and I see colleagues, but I didn't actually see any African-American females. There were couple African-American men, Dr. Scott, number one, another good friend, Bryant Jones in Pennsylvania. And then moving here to Virginia, it's also funny that these are both states are Commonwealth. So Commonwealth means that they were like the original 13 colonies. So that's Boston, Pennsylvania, and Virginia. And then again, getting here in Virginia and just kind of seeing the whole room of men surgeons, you kind of shrink and kind of close up like a flower because you don't know who to talk to. You're not sure who's welcoming you. You went through the same training and the rigorous academic requirements to get there. And you just wonder to yourself, how come no one else? Now, don't get me wrong. There are a bunch of oral and maxillofacial surgeons that are women, that are Black women in Maryland and DC. It's just they haven't come across the state line to Virginia. That's all. I'm not saying that there's, I'm not one in a million in the world. I'm just happen to be the only one in the state of Virginia. And so I want to stop saying that. I've been mentoring women. I've been mentoring students. I've been saying it enough. I'm ready for someone to say, okay, well, there's Annandale, Arlington, Alexandria, Richmond. We got plenty of little spots. So yes, I am. And I wrote a book about it. It's called Training Ivy, How to Become the First Practicing Oral and Maxillofacial Surgeon in the state of Virginia and the Commonwealth of Pennsylvania. So someday I hope to inspire some some women to make a change. Oral surgery is wonderful, Dr. Stuckey, as you are quite aware. I mean, just the masterful skill of problem solving and getting to know our patients and figuring out what their concerns are. I know there's more women who can do it. So I support anyone who tries. Absolutely.
I love that. That's so awesome. Can you talk to us a little bit about the school that you started and
Oh, yeah.
all that?
Okay. Yeah. So I was talking to Dr. Stuckey the other day. I say, sir, it's never too late to plan for retirement, never too early to plan for retirement because, you know, I have this little saying where I say, we need to think outside the socket because we're always so focused. We're always so geared to those two little spaces and the little interradicular bone, two little circular oval shapes for a two-rooted tooth.
Yep.
And we're looking so carefully at that interradicular bone. We're thinking about how we're going to hit it with our pilot drill so that we can place an immediate, because we do not place implants in the mesial or the distal. We place it in the interradicular bone. That's how we do it. And we also know about the measurement of a bone between the inferior alveolar nerve and the apex of the tooth. So we have like this tiny little spot. That's our focus. And once we do hit that spot, I think of a rival named Tom Brady from the Patriots. He used to hit those targets day in and day out. Once we hit that interradicular bone and we get our pilot drill in and we put our paralleling pin in and we pack graft material into our mesial and distal sockets, we pull our paralleling pin out and we come in with our implant, put our membrane on top and close and protect the wound with sutures. Guess what, folks? There's more than just that socket. There's more than all the little bit of crazy anatomy in that socket. I even secretly admire the curvature of the way that the interradicular bone, it's a little bit, sometimes if you look real carefully, it has like a bulbous part. It's circular. And then it goes down into a curve down into the apex of the tooth. I mean, I love it. I love every nuance of the socket anatomy. But you have to think outside the socket. You gotta lift your head up, quite frankly, even out of the mouth and out of the operatory, out of your office, and realize that you have great potential and power to do wonderful things that you didn't even know you could do. If you can appreciate the little bit of anatomy of interradicular bone, imagine if you were a CEO of a corporation, blow your mind, or imagine if you wrote a book, or imagine if you started a school. So I started a school called International Implant Institute to teach general dentists how to place more implants. I thought, if I could do it, you guys could do it too. You don't have to refer out an edentulous space number 5. Mm-hmm. There might not be so much anatomy there, but, and you don't even have to make a flap, blow your mind there. It could be flapless surgery that you just drill the hole into the area where you think the implant should go. So the school, it has been very productive and very successful. We've had quite a few graduates from all over the world, Dr. Stuckey. Wow. We've had participants from Kenya, Nigeria. We've had participants from California, Alabama, Georgia, Jersey, the DMV, and it really is a wonderful opportunity to be more connected with general dentists. As an oral surgeon, I don't think we as specialists really reach our hands out to them and welcome them. They feel kind of lonely out there. They feel like they should just refer everything out because they can't do it, but they should and can. And so the school has multiple parts to it. We have chairside concierge service where I'll go to a practice and basically hold their hand and help them place implants. We have online courses, socket grafting tutorials, and the business of dentistry. We have a 5-day hands-on course with model surgery where students will come in for 5 days, we'll place implants socket grafting, CPR training, a tour to a dental lab to show them exposure of cutting edge technology. We have webinars, which are live communication webinars. So our site, International Implant Institute, has a plethora of educational options for soon-to-be surgeons, residents, implantologists, general dentists, periodontists. We love periodontists, and just people who are really interested in expanding and broadening their perspectives.
That's fantastic.
Thank you.
What are some of the main benefits, to your career, your life doing this school?
I think the school is just a wonderful way to stay in touch with curriculum. I mean, it is a continuing education program. So as you are aware, Dr. Stucki, all of us have CE requirements to renew our license. Mm-hmm. So to be a CE provider just makes it more important that I am on the cutting edge of technology and education. So I think the school gives me good communication and connection to education. Again, thinking outside the socket. It's not just that I have to go take a CE, but now I'm actually teaching the CEs. So I really believe that this keeps me grounded and academically stable. I do think that it is an exit strategy, one day maybe full-time as a clinician and academic. Sometimes folks tease me. They say, "Why don't you try some teaching?" Teaching, So they'll say, "Why don't you go to VCU, which is Virginia Commonwealth Dental School?
Yeah.
Or why don't you go to Howard, since it's not far in DC? Or why don't you go to Maryland?" I say, "Why teach here at International Implant Institute?" And we have 12 different faculty, multiple specialty faculty. Periodontists, oral surgeons, general dentists, prosthodontists. We have a hygienist on our faculty. So it does keep us all motivated and engaged in academia. I also think that the Institute keeps us open to other disciplines. So, Dr. Stucki, we did a course called The Business of Dentistry, which involved lawyers and accountants and commercial bankers and mortgage loan officers. So we try to find experts outside of dentistry to bring to the school to open exposure to our participants. So not just dental curriculum and implantology. I can talk about prosthetically driven implants all day. But if we find out that we need to have a conversation with a CPA about a P&L, you guys are like, "What's a P&L?" Exactly. You should know a profit and loss statement is regular verbiage in business, or quite frankly, SEO or ROI. I got a whole new alphabet thinking outside the socket. ROI is return on investment. SEO is search engine optimization. This has to do with marketing. We don't talk about that. When I was in dental school at Temple, I didn't even know we needed to know about marketing. So I think it just opens the eyes of the participant and us as faculty of some of the things that are important outside of dentistry.
Nice. I mean, I know there's probably a lot of oral and maxillofacial surgeons, and I'm sure periodontists who maybe don't or maybe aren't sure but don't feel comfortable teaching implant skills to general dentists. And there's probably a fear that if you teach them, then they won't refer. Have you found that to be the case, or what have you found to be true in teaching a general dentist to do implants?
I'm going to start with the first part of the question, and I'm going to talk about the word fear, because believe me, teaching someone else how to do something well, you shouldn't have any fear there. There's fear is like, I should be fearful when I walk into a room full of strangers. I can't be fearful then when I said that I have to close up like a little flower, or fearful when I'm looking at the list of people in my class, and I'm fearing, am I going to be able to excel because of the curve of the class academic challenges? I mean, that's fear to me. I fear for myself, but not to fear to help others. How could you possibly have a fear that if you taught somebody something, they might be good at it? I mean, you could actually help them be better in our society. And you know what happens when you help someone be better? You have gained a friend. You have gained a colleague who now trusts you. You have gained someone who can then ask you to help them with other things that may be outside of their skill set or their caliber. So teaching a general dentist how to place an implant in an edentulous space, gosh, you have so many other things to fear. That's the least of your things to fear. That's like fearing to open the door for someone to come in. You may learn something from them. There's so much you can learn. They went to dental school too. So they kind of know tricks of ways of working with their hands or mastering a project. There's no fear there to help someone learn how to be better. What if your teacher was scared that they would teach you how to be a good practitioner? You wouldn't be able to move forward. We have to all hold hands and move forward. So I want to start with the fear part. So let's say you said it differently. Let's say, well, we as the profession of oral and maxillofacial surgeons want to keep implants only ours. Well, that's ridiculous because general dentists were placing implants before oral surgeons. Hope you all knew that. Absolutely. General dentists were placing them before you all were, or we all were. So that's outrageous. What if they feared teaching us? Now we wouldn't know. So, or what if we say we fear or we don't want to teach them because they might get good at it, and now we have to be better at something else that we're good at. There's like 7 different parts to oral surgery. You could be good at pathology, you could be good at trauma, you could be good at TMJ, you could be good at dental alveolar. I mean, it's not like we don't have anything else we could do. And to be very honest with you, if there are general dentists who want to do oral surgery procedures, right on. Good. Be better practitioners. We don't need any more people with dentures that are coming out. We don't want to have them use Fixodent. We want to make an army of practitioners who can place implants. We want public health to no longer need to have grandmom have her removable denture. We want public health practitioners to place 2 implants on the mandible so that everybody can have implant retained dentures. Wouldn't you agree, Dr. Stucki?
Yeah, I mean, that's definitely a better world for patients.
Everyone. Right. So what is it that we're fearing? We're fearing that either they're going to get good at it. We're fearing that they're going to be able to do it. We're fearing that they'll make more money than we will. What in the heck are we fearing? I have no fear to help others. No fear.
I mean, I agree. That resonates with me, of course. I mean, I've pretty much given every surgical secret, everything I've learned, I've given it to this podcast, to these listeners. I know many of them are dental students, many of them are general dentists, but I feel the same way. I feel like when you're trying to help others and teach them, it just improves the whole experience for patients, it connects us as practitioners. And in the end, it benefits you as well. It just always comes back to help you in some way. So it's a good thing.
Absolutely. I used to get I used to get a feeling that I can't really describe very well when I would successfully remove a tooth. Oh my gosh. It's such a feeling. I don't even know how to explain the rush of accomplishment when you get a tooth out. Okay. There hasn't been a tooth that's beaten me yet. I am undefeated champion. There is not one that I could not remove successfully or had to have some, reason to not get it out. But here's where I'm going. That same feeling of unbelievable excitement, it's duplicated when you teach someone else how to do this. When you teach a general dentist how to do an atraumatic extraction, when you teach a general dentist how easy it is to socket graft, and they understand now that we're doing this for predictable results in the future, it is also an equally enjoyable euphoria. So there's no fear. I mean, it's you can't you just get that out of the way. It's I'm going to show you how to do something that you can absolutely do. So that's my short story there. I'll keep that one brief.
Yeah, to follow up on that, I mean, I think maybe there could be, I don't know if it's fear or concern, that maybe you teach a general dentist a little bit about placing an implant, and then they take that, and maybe go to a place where that's more complex case and they get in trouble, and now you're probably having to try to get them out of a sticky situation. I mean, we've all had that experience where, a dentist tried to take a tooth out, broke the crown off, couldn't get the root, sent it to us, and we finished the job. But I mean, we all started at some place, right? We all, and I'm sure you're trying to teach them their limits and their boundaries, and saying, hey, here's a good case, and here's maybe a case you should not take on. Does that sound right?
Absolutely. So it is all about patient selection. We just had a course February 2nd through 6th. And I had a student, a general dentist from New Hampshire, who asked me about doing a sinus lift on a less than 3 millimeter site. And I politely looked at him and said, not every case is an option. Just let it go. He's not the one. But I also make sure that I say very carefully, and this is a little bit long-winded. Dr. Stucki, you've been to one of these restaurants that has, nice plates and hard silverware and glasses, right? And maybe a candle. And the man comes over and gives you a menu, and you're reading the menu. You can read, it's not like you can't read. But he will tell you, the waiter will tell you all of the options on the menu, all the specials. Every single table in the restaurant hears the specials. Every single patient that walks into your office should be discussed implants. If they came in because they have a fibroma on their cheek, you take a panoramic x-ray, you notice that they have an edentulous space next to the fibroma, that's an implant patient. You have a patient who has a chipped tooth number 4 and a edentulous space number 5, that's an implant patient. So every single person should be given implant discussion, but not every single patient is an implant candidate. So that's the distinguishing factor there. As long as they are aware of the conversation, the patient should be educated. But you as the clinician should then be able to have a educated criteria of who is a good candidate and who's not. So back to my student, we're not doing sinus lifts if we don't have to. This is a general dentist. If he's not equipped with doing a sinus lift, then certainly, as a academic, I kind of think of it like swimming. I want them to be able to swim in the shallow end, but I'm not going to push them off into the deep end and not have some kind of lifeguard or inner tube or some type of way to keep them safe. I want them to be able to progress from the shallow to the deep. It's like a survival skill. Everyone should know how to swim. Everyone should know how to at least place an implant. You have to know your criteria of when it is appropriate to be utilizing that training. Does that make sense, Dr. Stucki?
That's a great analogy.
Yeah, thank you.
That's awesome. What advice do you have for, younger residents, surgeons who are trying to figure out what to do with their careers? Because it sounds like you've had a lot of different experience, and you're a very determined, dedicated person. You've had great success. How do you counsel the young potential surgeon who's trying to know where to go?
Yes. The two words might be two. 3 words. Do not quit. Don't quit. Don't quit. In the darkest of the dark, in your weakest point, when you're just at your lowest of the low, you don't know if you should eat or study or sleep, don't quit. Just don't quit. Don't ever give up. Don't ever think that you can't. And don't listen to these people who are telling you that you should, oh, why don't you stop now and start making some money? Who cares about money? Don't worry about the money. The money will come. Don't worry about the money. Do not worry about the money. There's another silly movie. If you build it, they will come. Don't quit. Don't quit. If you feel like you don't know anything about business, don't quit. If you feel like you're swamped and now, the lady at the front desk wants an increase and your assistant just told you she's pregnant, she can't be in the room with nitrous anymore, and your wife is mad that the school called because the kid has, a rash. Don't quit. Just don't quit. Don't quit. Don't quit. That's all I can say. I mean, I can say one more. Winners never quit and quitters never win. Don't quit. Whatever you do, just keep going. Call me. Ask me about it. Tell me the entire story, soup to nuts. I will listen and we will figure this out. We'll find a plan. We'll figure a strategy. We'll pray about it. If you pray, whatever, just don't quit. Don't quit. I think don't is the conjugate of do not. So it's 2 words. Don't quit. Those are my 2 words, Dr. Stucki.
Oh, I love it. Absolutely love it. Because becoming an oral surgeon and all the work it took to get there, I mean, I honestly feel like most oral and maxillofacial surgeons, the reason they became oral maxillofacial surgeons isn't primarily because we're smart. I mean, that's what people think. Oh, you're so smart. I really do think it's just being tenacious and figuring out a way to persist in the face of extreme resistance.
Absolutely. Absolutely. In Philadelphia, we call that grit.
Yes.
Yes, sir. Yes,
exactly.
Sir. Yes. Yeah.
And I love that comment about not quitting, especially for the money, because I feel like almost all of us have a story of being pitted up against a situation where it was like, we could potentially make more money, or we had to make that decision. Do we kind of give up on our dream to be an OMS now because it looks so daunting, and just make the fast money as a general dentist or some other means of earning money? And you have to kind of have a vision and say, hey, this really is what's best, for me in the long run from an educational and even a financial position. But it's very hard to sometimes have that vision when, things are kind of closing down on you. My story that I come back to is I was a first-year resident, and I was just horrible. I mean, my first couple months were just abysmal, and my program director had this meeting with me and said basically that. He's like, you're pretty bad, and I'm not sure I'm not sure you're going to make it, basically. And I went home after that meeting and I was so depressed and thought he's probably right, maybe I'm not meant to be an oral surgeon. And I talked to my wife, and she said, no, you've come too far to quit. We'll do whatever it takes to make this happen. And so she kind of slapped my face and poured the cold water on me. I'm lucky I had her. But I think most of us have an experience like that where it's very tempting to just quit and say, this isn't meant for me, or I'm not, X, Y, and Z. I can't make it. What do you think about that?
I think that not everyone has a wife like you. Exactly. And some of them are sitting in a dark room on their own, looking at the sky or the walls, the ceiling, and wondering, how long is this going to go on? And why do they keep dumping on me and telling me I can't do it, and telling me that no, oral surgeons don't look like you. What the hell does that mean? What? They don't look like me, right? Don't they have 2 eyes and 2 ears? Or I mean, the things that the people will say to you to take you off of your path. Just don't quit. You can't. My dad used to use the analogy of in New York City, they have the horses that carry the carriages, and the people sit in the carriage and the man rides the horse. And the horse has to, because this is in the traffic of New York City, there's hustle and bustle, there's taxis, people honking, buses, and the horse has to have blinders on. Because if he sees all of this, then the horse will scare and run with the carriage. So my father would say, you have to have your blinders on. You have to focus like this. Don't be distracted to the left or the right. So I know that there's some young woman or male or person in general who is sitting there wondering, well, they told me I should go to peds. I'm really good with kids, but I want to be an oral surgeon. Or maybe I should do ortho because it's only 3 years and I'm a wire bender and I don't like blood. Okay, fine. You're a wire bender. You go do ortho. Or I think perio is just as easy or interesting, but oral surgery, oh no, it's 6 years. I don't want to do that. Just don't quit. If it's in you and it's supposed to be for you, that's what I say to that is not everyone's as lucky as you to have a wife. Sounds like this was early in dental school or maybe even in residency. I do know some of my colleagues were married in dental school, but I didn't get married till I was 38 years old. So for the ladies out there who are listening, don't quit. Okay. And I'm a mom. I did get a chance to be a mom. I have an 8-year-old. He's a 3rd grader. Yeah, man. So it works. There is light there. You don't know how many times I laid thinking, well, how is this supposed to work out? And when is this going to happen? And you know, I'll tell you another little secret. When I would date men, I had to tell them that I was a radiologist, because they had no idea what oral maxillofacial surgery was. They're like, what does that even mean? So I would come down to, well, I look at x-rays and, so that's where radiology came in. So ladies, don't quit. Don't quit. That's all I can say.
Great advice. Truly great advice. And and come up with all the skills you can develop to not quit. It takes a lot of life experience, grit, skill to get through tough situations.
Yes. Persistence. And I liked your word tenacity. Absolutely. Absolutely. Like trying to get the meat off a bone. Just keep it going. And if you're raising a flap, you'll find the small area between the periosteum and the bone. It'll just fly right off. I love hydrodissection when we're trying to remove tori. You add a local in there. You cut. Easy. No tenacity necessary. It just comes right apart. So absolutely. You if it's spiritual, you go outside, talk to the moon. I don't care what you're doing. Just find a way to keep yourself motivated. My dad used to say, you can't lose with what you choose. I think I would eat popcorn or go to the movies, try to find ways to have some time of normalcy, and also be careful who you're talking to, because sometimes you'll ask someone, don't ask the endodontist how you're going to get into oral surgery. That's not going to work. Ask an oral surgeon. Make sure that it's someone in the field of what you want so you can get to where you're trying to go.
Yes. Yeah. One more comment too is I've seen many quit who were incredibly smart people. And what I think when I studied these people and thought, how did that person quit? I mean, so much smarter than me. I came back to a common theme, which was what I thought was perfectionism. People who wanted to be perfect, we're always the top of their class. And then finally they get to oral surgery school and there's something they're bad at. They're told they're bad at. I mean, we know how dysfunctional some of the teachers are in oral surgery school. Right. And they're told this on a daily basis. You are so bad. You're the worst you've ever seen. And all of a sudden the world comes crashing down. For a perfectionist, that's kind of like the end of the world. And so it's like, oh, well, you lose all confidence in your ability to do it. And then when that happens, you say, oh, I have to quit now because I can't make it. But there's people like you, and I've seen people like this. I've seen people who've done 4 or 5 years of internship, one after another. And you did 2, which is also remarkable. But to be able to persist in that phase and maybe not have the opportunity and maybe be passed over, but to say, I'm going to do this again, and I trust that it will work out is, wow, that is an incredible skill to have.
Yes. There's a name for that one too. It's called stick-to-itiveness. It is really a word, stick-to-itiveness. It's the do not give up phase. I have a quick story. So when I did start Howard in 2007, it was three of us. It was a male that I knew from New York. His name was Robert, me, and a male named Dominic. And you know that these programs only take about 3 a year. So that's a big deal. And of course, I'm the only woman in my 3, right? So the first year we started together. The second year, Dominic said that he wanted to transfer because I think in this kind of perfectionist thought process, I don't think he wanted to graduate from Howard. I thought, why? Let's just get done with this. What are you talking about? He wanted to transfer out. And so he started at Pitt. So now second year, it was just Robert and I. So now we're down to 2. Dominic is at Pitt, and Pitt told him that his first year at Howard wasn't going to count. We're like, what? So he had to start over again. Dominic is also not an oral surgeon, because after all that, that was it. I don't even know if he did the third or the second year at Pitt. So in our third year, I think it was our third year, we got a new guy. So the fourth year, now we're back to 3. And I have the picture of the 3 of us graduating from our program in 2011. So yes, that also has to do with perfectionists. Not everything's going to be exactly the way that you think it's going to be. Even with your flaps, even with your implants, even with some of the challenges in life, don't beat yourself up, right, Dr. Stucki? You don't want to make it so that you come down on yourself. If he graduated from Howard, he'd be an oral surgeon today. He wanted to be an oral surgeon, but not from that school. Well, guess what? You're not going to be an oral surgeon at all. Yeah. Right. So if you keep trying and fixing and moving and changing and working and trying, you're going to break it. Just let it go.
Yes.
So that's all I got.
I really appreciate you giving that advice. I think this will help a lot of our listeners. A lot of our listeners are residents or dental students, young surgeons. And this is just a philosophy or a principle that applies to us even as oral surgeons. Like you're saying, with each patient, we have difficult issues and office business things that happen, family life. There's many things that you got to kind of have some tenacity for and hang in there. And I love this school that you're doing. I think this is so fantastic. If there's listeners who want to explore this further, where would you send them to learn more about your school?
I think the easiest one is find me at extractionjackson.com. People call me Extraction Jackson. I started in dental school. I took out more teeth than anyone in my class, Extraction Jackson. So I claim that one, extractionjackson.com, which will lead you to International Implant Institute, spelling international INTL, and then Implant Institute. And so International INTL Implant Institute.com. You can find me on LinkedIn, Dr. Julia Jackson. You can find me on Instagram at Socket Grafting Girl, Socket_grafting_girl, Socket Grafting Girl. You can find me on Facebook. I have a women's club, not just women, but it's called the First Ladies of Dentistry Study Club. It's for women in dentistry. And we do a lot of workshops. We do a lot of CE. We do a lot of networking and collaborative activities. So First Ladies of Dentistry, and that's first, FIRST, not one ST, but first. And you could probably find me, if you just Google me, I'm around. I hope you find me on Dr. Stucki's podcast. I can't wait.
For sure. Well, good. We end every podcast with some rapid fire questions.
Yes, I listened to some other ones. I hope you mixed up the bag. I'm ready.
First one is, what's the best book you've read in the past year?
Yes. I really enjoyed this one called Burn the Boats. I think the author's name is Matthew. Burn the Boats. And why I love it is it's because it's this die-hard philosophy, like almost with warriors or military. If you go out to conquer a land, burn the boats because you're not going back. You're only going forward. It's still that same kind of philosophy as like, this is happening, come hell or high water. It's a really good book. It has a great story. I think the guy ends up being a Shark Tank judge. Like, he does end up being a multimillionaire. He dropped out of high school with a strategic plan that he could get his GED faster than he could get his diploma, and he wanted to be able to take college courses. So that's why he dropped out strategically, so that he could get his GED before he graduated, or, he got his GED before his friends did. It's called Burn the Boats. It's brown cover. Yeah.
Yeah, I see it here on Audible. I'll have to listen to that.
What's his last name, Matthew?
Higgins, it looks like.
Yeah, okay, Matthew Higgins. Good book.
Yeah. Good book. Awesome. Next one is, what's the most helpful kind of non-oral surgery thing you do in your life that also translates and helps you with your daily oral surgery skills?
I don't do it daily, but I do put jigsaw puzzles together. It's kind of like a hobby. It's very mind stimulating. And then once I put them together, I frame them. So I like crafts. I like to do things to work with my hands. I'm really good around the house. My husband loves me. I'm very handy. I fix most of the things around our house. If there's something that needs to be fixed, it's not too many things broken. I'll do a lot of around the house projects, painting the shutters, painting the outside patio furniture. I'm really crafty. I'm a hands-on kind of person. So I always keep your hands moving. Embroidery, just projects. I do projects with my kid, science projects, things like that.
Awesome.
Yeah.
What forceps do you use to extract tooth number 14?
14, I use an upper universal number.
150.
Yeah, 150. Thank you. Number 150. Right. Actually, I never, ever, 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 ever use a 151. Never.
Oh, interesting.
Never. I'll use a 23 or I'll use a 150 on the mandible. That's why I think it's called universal, because it can be used top and bottom. The last time I heard you ask this question, though, it was for a premolar. So I was ready for my Ash answer, but I'm glad you got me there. It's 150 is my answer for number 14. 150.
Okay. Well, what about number 12? Would you use the Ash or no?
Nope. Ash is not used for uppers. I've seen people use it up there. I don't agree. Ash is not for uppers. Ash is for 21, 28, 29, 20. It is not an upper forceps.
Because it just doesn't fit, or what?
It does not fit. You have to hold the mandible and you need to hold the Ash. That's it. I don't even know how you're doing this up here. So no, I would use a 150 for 12. Anything up there, quite frankly. 150. I'll use, I don't know the number, but it's like just a complete straight for like 8 and 9 straight forceps. Does that have a number?
Yeah, but I don't know it at the moment. I know what you're talking about. Yeah.
I will use a well, I'll leave it at that. That's my answer. Yes.
How about best movie or TV series you've seen in the past year?
I did like White Lotus. That's a naughty, naughty show. I don't know if I should be telling you that, but I liked it because the director went to university, Wesleyan University in Connecticut.
Oh, really?
So I have to, it's pride to my undergrad school. I thought White Lotus was pretty, I hope this is an adult audience because it's very raunchy and, but it's tantalizing, and it is got good mystery. It's called White Lotus, and Any other series that I don't watch a lot of television, so I can't say that I've been sitting there and binge watching anything really. I'm over here working on my puzzles. I'm not watching too many television shows.
That's good, though. That's probably better for your hand skills. Do you have a favorite quote?
I'll keep it to the same one I said. Winners never quit. Quitters never win.
Love it. And then last question is, you mentioned you have, you said a 8-year-old or a 13-year-old?
Yeah,
8-year-old? Yeah. What's a parenting tip you have for our young parents out there listening?
Right now, we're in the stage of trying to understand what it means to have respect. At 8, he's in 3rd grade. Okay. And he came to me with a statement that was, well, Mom, respect is earned, not given. I said, okay, who's this kid been listening to, right? But I think what he needed to know is that moms have already earned the respect, quite frankly. So the respect that he's going to give me is what other people have to earn from him. And so he will hold me to a high regard because simply I'm just his mom. But he is correct. It does need to be earned from others for him to then treat them as well as he treats his mother. So that's what we had to just get the understanding there. My 8-year-old is very smart. He's an excellent conversationalist. I really enjoy speaking with him and exchanging ideas. It's kind of weird to have that feeling about someone who's so young. I think it's because he's an only child. I think it's because he has undivided attention towards him. So he speaks well, and we have conversations about life, about politics, about basketball. So I think as a parent, I think just having good communication, always open. Sometimes he wants his own private time. That's fine. He's becoming independent. So keep going. You guys are doing a great job as parents. There's no handbook. You can't go wrong. I think we're just navigating the waters as they come, and always it's good to have the co-parent. My husband is a good co-parent. So if you have an exchange of ideas, it's good that my husband and I talk about things before we bring it to our son, even though my son is Mr. Intellectual. I don't want to have the conversation of, are we going to camp this summer with the 8-year-old before I have it with the husband. So, establish those conversations first, and then report back to the little one. So that would be my 2 cents. I'm not the best parent. I'm still trying to figure out how it works. I feel like parenting and being a mom comes naturally. It's being the wife is the part that takes more effort.
Yes, I can understand that for sure. Well, Julia, this has been so fun talking with you. I've loved our conversation. You're awesome. Thank you for taking the time.
Thank you, sir.
Yeah, we'll put your contact information in the show notes in case listeners want to reach out. But it's been awesome. Love to do another episode with you sometime.
Thank you, Dr. Stucki. I hope so too. Thank you.
Have a good rest of your day.
All right, you too.
See ya. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayOralSurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.